Hello, Anna Moore, IV Practical. Okay, first I'm going to go ahead and I'm going to check the MAR. I'm going to check for any inconsistencies. I'm going to check to see if the patient has any allergies, and I'm going to check see if there's any contraindications. I'm going to look the IV back. I'm going to see if the color is okay. I'm going to look for any leaking, and I'm going to make sure that the expiration date is not expired. Okay, I'm going to go ahead and gather all of my equipment, and I'm going to wash my hands and put on PPE if it's indicated. I am then going to provide for privacy, and I'm going to go ahead on into the room. Okay, I'm gonna go in. I'm going to introduce myself. I'm going to make the patient identify their name and date of birth, and then I'm going to ask them if they have. No, I'm going to explain the procedure. I'm going to tell them I'm doing an IV insertion today into their arm, and I'm going to be setting up their IV bags next to their bed. And next I'm going to ask them if they have any allergies. I'm going to ask them if they have had any recent surgical procedures done that might contraindicate the use of the IV use. I will then ask them if they have any allergies to any tapes, anything like that, or anesthetics, which we could be using. If we were, I would explain what it did, how I would be using it, and then I would go ahead and apply that to their arm, and I would let it take effect for a couple minutes. It might take a little bit long. Okay, moving on to the procedure. I'm going to go ahead and compare the IV bag with the MAR, as I should always be doing. I would then go ahead and check the color of the IV solution, see if it's and there's any leaks, and I would make sure the expiration date it wasn't expired. Okay, I'm then going to go ahead and scan it if I am able to, according to my institution. If I wasn't, I would just go ahead and label that as thoroughly as I could. Okay, I would maintain aseptic technique during this whole entire procedure, so making sure not anything dirty touches anything dirty. Okay, I'm gonna go ahead and open my IV bag. Oh, I would also make a timestamp, so make a little label and put like what time I started this on. I would put it on wherever, yeah. Okay, so I'm gonna open my IV bag, and I'm going to, I'm gonna open my IV bag. I'm going to hang it up on the IV pole. I'm then going to open up my IV administration tubing. I'm going to take it out, making sure not to touch anything. I'm going to take off both caps on both of these. I'm going to spike it in, making sure I don't touch any part of the cap, inside of the caps, because that is not maintaining a septic technique. Okay, after I have that, I'm going to make sure that, before I even do that, I'm going to make sure that the clamp is closed. Very important. Okay, so after that, I'm going to squeeze the chamber, make sure it's about halfway full, dripping, and then I'm going to hold up the end of the tubing, and I'm going to unclamp it. I'm going to let the air bubbles get out, because if they don't, your patient could get air emboli, and that would not be good. So I'm going to flick at all the little ports, make sure there's no air. Okay, there's no air. Okay, I'm gonna clamp it back up. That tubing is primed. Okay, so after that, I'm going to recap it. I'm gonna recap the IV tubing. Okay, we're gonna move on to the piggyback medication. So before I would do anything, I would go ahead and check to see if there were any incompatibilities. Make sure those don't precipitate in the patient, which is extremely awful. So I'm not gonna do that. So I'm gonna take out the piggy bag, and I'm gonna take out the piggyback tubing. I'm going to clamp the piggyback tubing, and I'm going to invert it and spike it. I'm then going to hang it up, and I'm going to prime my ports. Boop, boop. I'm then going to, I'm going to prime it by scrubbing it for 10 to 15 seconds and then letting it dry. Just don't want to make sure there's anything getting into the medicine that shouldn't be. Okay, so I did that. And next I'm going to I'm just gonna twist it on, and then after that I'm going to clamp it, and I'm gonna squeeze the drip chamber, getting it like halfway full, and then I can unclamp it, and I'm going to let all the air bubbles get out of the piggyback tubing. Sorry, battery warning. I'll let all the air bubbles get out of the piggyback tubing by flicking it, and then at the ports, nothing. Okay, good. So then I am going to clamp them, recap them, and I'm going to take the IV tubing and I'm going to put the blue hanger on it, making sure it's lower than the IV piggyback, because if it's not, bad news. Okay, I'm going to unclamp them and put them at the rate that I need them to be, because the clamps regulate the piggyback drip rate. Yeah. Okay, so now I'm going to move on into the IV insertion into the patient's arm. Okay, so we already did all the introduction and everything. I'm going to I'm going to put the patient in semi-Fowlers, low semi-Fowlers. Like, actually just be low Fowlers. Okay. Then I'm going to put a towel or something underneath the patient's arm. I am then going to make the arm go lower than the heart level. I am then going to provide any emotional support that the person might need, because it's really tough getting an IV sometimes. Okay, so I'm going to go ahead and open my J-loop, and I'm going to open my syringe with sterile saline in it. The syringe, I'm going to have to prime that because it has a little air bubble on the top, so I'm going to need to get that out. Okay, good. It's out. I'm going to twist that on my J-loop, and I'm going to prime that tubing. Pushing it through. Okay, good. I'm going to put that down on the packaging, and I'm ready to go. So I'm going to take my catheter needle, which is not open yet, but when I do, I'm going to go ahead and tourniquet the patient's arm. I'm going to be looking for any distended veins. I could tap on it if I couldn't find it, or I could massage the arm, and if I really couldn't find it, I could just take off the tourniquet and put on a warm compress for 15 to 20 minutes, give or take. Okay, so the tourniquet is on, and we found a vein. It's pretty distended, so then I would take my alcohol wipe and I would scrub it for about 20 seconds, and then I would let it dry. Sorry. Okay, then I would let it dry. After it is dry, I would take my catheter needle and bevel up. I would take off the cap and bevel up. I would go into the vein, and I'm going to go towards the heart, and I'm going to feel a little bit of give from the artery, and I'm going to try not to go all the way through. We're just going to follow the artery, and I'm going to go until I see a little bit of blood return. When I do see blood return, I'm going to go ahead and advance the hub until I meet the arm. So I'm going to push the little blue part in, and then I'm going to take the needle out, and I'm going to safety it. Very important, safety your needles. Okay, I have that, and I'm currently having this catheter in my arm. So what I'm going to do, I'm going to take an alcohol swab, and I'm just going to scrub the hub, and I'm going to take the IV solution. I'm going to take off the cap, and I'm going to scrub the hub. I'm then going to twist that in. I'm then going to have that going. I'm going to tape it with a label with the date, time, patient name, and then I'm going to flip it over, and I'm going to put another piece of tape on it. So there's 2 pieces of tape on this, making it super secure and accessible also. So the drip rate is controlled by, I'm going to make sure the drip rate is what is ordered. I'm going to go ahead and check that again, make sure everything is all set up, and that is how you do it. So after you're finished with all your stuff, you're going to throw away all the appropriate things, and you're going to go ahead and take your syringe, and you're going to take your needle, the whole thing, put it in the sharps bin. Yeah. You're then going to take everything else, put it in the trash, and you're going to clean up your workspace. You're going to lower the patient's bed back down, and you're going to go ahead and monitor them for a while to see how they do with the IV medication, see if they have any adverse reactions, and then you're going to make sure their call is within reach. You're going to ask if they need anything, and then you can go.